Uh, Good evening from Kenya, everyone. My name is Cicilia Githaiga, and I work for the ABS Capacity Development uh, in Kenya. We are here today to address ourselves to a specific topic from theory to practice. A very interesting topic, I must say, and we have the pleasure of being joined by the most gracious panelists who have been there and have done that. And now they are here to share with us the knowledge they have and the experience they have. They cut across disciplines from academia to environmental enthusiasts to engineering, forestry, limits. Kindly allow me to introduce to you Mr. Vik Mohan, Ms. Jane Davison, and Mr. Viana. Because we can't clap for them, I would invite you to give them a thumbs up or an animated clap, and yes, they will respond appropriately. So without much ado, allow me to introduce Mr. Vik Mohan, and he will tell us a bit about himself and his background. Mr. Mohan, the floor is yours.
Thank you, Cecilia, and hello, everybody. It's really exciting to be with you all today. So my name is Vik Mohan. I'm a practicing doctor in the UK, and I'm also the Director of Community Health to Blue Ventures Conservation. We're a marine conservation organisation. We work with coastal communities in the tropics to help rebuild fisheries and support community-led marine conservation. We work in areas where communities are highly reliant on marine resources for food and for income. Often these are areas of high poverty, where communities have limited access to alternative livelihoods and limited access to basic services such as health and education. And what we find is that issues such as poverty, issues such as poor health, limit communities' ability to engage in the complex long-term work of rebuilding fisheries and managing marine resources in a sustainable way. So what we do is we take a holistic approach to working with those communities. We focus first and foremost on fisheries, on their livelihoods, supporting them in management measures that will help to rebuild their fisheries, because no one stands to gain more from healthy marine ecosystems than coastal fishing communities. We then, where possible, support communities to diversify livelihoods, reducing reliance on fishing, and where poor health is limiting communities' ability to engage in conservation, we support them to improve health, to have improved access to healthcare. So this multi-sector holistic approach, recognizes the interconnection between human well-being and the well-being of the environment. And also we think it represents an exciting solution to one of the biggest planetary health challenges, that of protecting ocean biodiversity whilst safeguarding the livelihoods of the 100 million small-scale fishers living in the coastal tropics who rely on fishing for food and for income. So that's me. Lovely to be with you all, and I'm looking forward to our session. Over to you, Jane.
Thank you, Mr. Mohan. Jane, the floor is yours.
Thank you very much, Cecilia. And I'm delighted to join this very important panel in contributing towards the conference today. And I was particularly taken by what Vik has just said about a holistic approach. And I think that there's going to be a lot of sessions in this conference that talk about holistic approaches. And I was invited to contribute today because I spent many years as a politician in Wales. And Wales in 1999, when it first got its own government, had a duty to promote sustainable development in everything that it did. And one of the things that became clear to me as the minister who was charged with that responsibility in the cabinet in Wales was that it's actually very easy to promote something and really hard to deliver it. And what we see governments talk about all over the world is essentially they promote, but they don't necessarily deliver. And so I proposed legislation in Wales that is called now the Wellbeing of Future Generations Act, which came in 2015. And that legislation now requires all the public services in Wales responsible to the Welsh government to deliver, not promote. and delivery is really, really tough. But it's about taking a holistic approach. And it's also about taking an approach that enables Wales to deliver on the Sustainable Development Goals signed up to by 193 UN countries. What I was quite shocked to discover last year when I wrote the book about this experience, Lessons from a Small Country, Future Gen, Lessons from a Small Country, was that actually taking this approach means that currently Wales is the only country in the world that has put legislation in place to factor in future generations. And one of the core parts of the way that that legislation works is actually about creating 7 goals that include planetary health. It's not expressed as planetary health, but it right at the heart of this legislation is that everything that happens in Wales, if it's about a low carbon society, it must be in the limits of the global environment. It must act on climate change. It must enhance biodiversity. It must address issues around people's physical and mental well-being and look at the choices and behaviours that benefit future health. It must focus on equality. Vik a moment ago talked about society, particularly those in poverty. It must be about creating well-connected communities. It must support culture and heritage, and it must be globally responsible. So I'm delighted to join this panel where Wales, we may be the only country that's taken that specific approach about human future generations. But of course, there are many other countries that have taken other approaches in terms of giving expression in law to forests or rivers or countries. So I think this is a really exciting way of reframing the debate, and I'm delighted to be part of this very special panel. Thank you, Cicilia. Diolch yn fawr.
Thank you very much, and we are also delighted to have you and Mr. Mohan and Mr. Viana in this panel. Thank you very much. Mr. Viana, the floor is yours. Your introduction, background.
Thank you, Cicilia. Yeah, I'm delighted to be with you all on this panel, which is very interesting. I think the concept of a holistic approach unites us all. And I guess the reason why I was invited to this panel is because I have a personal background that in many ways allows me to have a fresh look into this issue. I have had an academic career with a PhD from Harvard, and I was a professor at the University of São Paulo in southern Brazil until I moved to the Amazon permanently, about 20 years ago, to become state secretary of sustainable development of the state of Amazonas, which is the largest state of Brazil. And I was in this function for 5 years, and we were able to implement a number of things related to this holistic approach of sustainable development. And in the last 13 years, I've been Director General of the largest civil society organization of the Amazon. And I plan to share some of the lessons learned from this experience at PHAM. I think this group is fantastic, and I'm very excited to learn from you all. Thank you.
Thank you very much. Indeed, insightful. I already registered keywords, buzzwords like holistic, academia, and environmental conservation, etc. I'm sure we will have a very interesting discussion. Allow me to go back to you, Mr. Mohan. If you would kindly tell us about the experience you have in implementing programs on the ground that address planetary health. You could share your insights with the participants, and Mr. Viana and Jen, please also prepare to follow suit. Thank you.
Thank you, Cecilia. Yeah, that's a really important question. and we are an implementing organisation. And so I'm pleased to better report that our work builds on a very long tradition of holistic multi-sector programming that aims to improve the well-being of people whilst supporting the well-being of the ecosystems upon which those people depend. And this approach has evolved over the years. Many years ago, it used to be referred to as integrated conservation development. It's refined and then evolved into population health environment, population environment development, and planetary health. So we are standing up on top of a long tradition of working in a multi-sector way and thinking holistically about planetary health questions. And if you look at the literature, there's wonderful examples of really excellent practice that we can learn from, and really powerful and compelling data that speaks to the impact of these ways of working. If you look at the work of Blue Ventures, when we integrated community health services into our marine conservation work, the benefits that we saw went far beyond purely improvements in health. So to give you an example of that, as we integrated health services into our conservation activities, and as health of the community improved, particularly as health of women improved, these community members were better able to engage in a livelihood. They were doubling their income as a result of improvements in health. They were better able to provide for their families. They demonstrated an ability to think longer term as a result of greater personal well-being, greater health, greater food and financial security. They experienced a greater sense of empowerment. All of these things came about through that multi-sector holistic way of working with communities. And we also think that when you work holistically and address the multiplicity of community needs, it really helps to build community trust, an essential ingredient if we're going to collaborate to achieve long-term, complex, challenging goals, such as sustainability, biodiversity conservation, etc. And those value adds sit alongside the kind of operational efficiency you experience when you work collaboratively across sectors. And that's just the work of Blue Ventures. If you look in the literature, there are lots of examples of really compelling evidence that speaks to the impact of this multi-sector way of working. I could talk all day about this subject, but I'm going to stop now and hand it on to my respected colleagues. Thank you.
Thank you very much, and we could listen to you all day. But for today, thank you very much. We are very grateful. Ms. Davison, kindly, the floor is yours.
Well, thank you. And what I love about working with you all, when we've all got similar agendas, but we're doing it in different ways, is there's always a word, and you think, yes, that's the word. And Vic, it was about collaboration. I think one of the big issues for governments is that, particularly in crises, and of course governments across the world are facing a huge crisis in the context of COVID, and they're facing an even bigger crisis, but most of them haven't addressed it yet, in the context of climate change. And what is so important in terms of the way governments make decisions is actually about not just thinking for the short term, but thinking for the longer term, thinking of not just about making a decision which might then lead to another decision to deal with your first decision, but trying to make decisions that will have an impact and resonance longer term and down generations. And that's really the philosophy behind the Wellbeing of Future Generations Act. And I talked a few moments ago about the 7 goals that link to the Sustainable Development Goals. But in many ways, the most unique part of this particular legislation is it also enshrines in law the ways of working. And one of those is collaboration. So now all organisations in Wales responsible to the Welsh Government are required to think preventatively, to think long term, to demonstrate collaboration, to integrate the outcomes to the goals, and to involve people about whom decisions are being made. And that just changes the way in which you act in terms of making decisions. But it's also changing the decisions being made in Wales. So we have a situation whereby just in the last couple of years since the legislation was in place, they have the Welsh Government has gone for presumed consent on organ donation. It's outlawed smacking. It's given the vote to 16 to 18-year-olds. It's set up a youth parliament. It's changed the curriculum in schools. It's looking at social and green prescribing across the health service. You know, it's just changing the way decisions are being made. And it's really hard for some of the people at the top of the organizations who've grown up in the old system. But it's very easy for some of the younger people coming up in the organizations who want and are really heartened by having that permission to think differently. And one of the most exciting proposals that actually is being developed in Wales literally as we speak is the idea of a national nature service that reflects the principles of the National Health Service, so that it's universally available to all at the point of need. And the idea that all organizations would be able to, in a sense, put their land or opportunities into a system that can then be matched with volunteers, as well as with professionals, as well as creating more opportunities for training that will actually lead to major reforestation projects, but also tackling some of the issues around the way in which our peatlands are really unhealthy in terms of the way they've been maintained. So there's sort of a very exciting feeling around in Wales at the moment that it's not just about planting trees, because trees are only good if they're the right tree in the right place. And the idea that you take down trees and then replace them with a new one is not acceptable as a proposition. But the idea that actually we look at the country as almost as a patient in need of health care and support, and use a national nature service approach to achieve those outcomes, is generating an enormous amount of interest in Wales. So that's just one of the things that's happened among many others as a result of having legislation on future generations. Thank you.
Thank you very much, Ms. Davison. Again, we could listen to you all day. And we are going to have this opportunity today. And for now, we will move on to Mr. Viana. You have the floor.
Thank you, Cecilia. Well, I'm going to give a perspective from the Amazon. The Amazon is in the headlines globally, unfortunately, for the increases of deforestation rates that have been the trend in the recent years. And it's a complicated story, but just to make it brief, I think this results from short-sighted political view of the current government, but also a chronic inefficiency of short-term and fragmented policies. And in this regard, I think my points relate directly to what Jane was just mentioning, the importance of having long-term policies. And we suffer from short-term policies associated with elections that occur every 2 years. And also the point that raised by Vik in terms of partnerships, because usually public policies are very fragmented. So our approach is to try to push for long-term policies. And here, I think there is a role of civil society organizations, such as FAS, that can bridge between different administrations and try to push for continuous progress along certain programmatic areas, and also in building alliances. So I'm going to share briefly just some images so that you can see what I'm referring to here. This is our headquarters in the Amazon. We have solar energy in our roof. We're 100% self-sustainable in terms of energy production. This is where we work in all Amazon areas of the Amazon country, because not every country has 100% of its territory in the Amazon, but rather a small part. And this is our definition of holistic approach, we call it a systemic strategy, by which all the 17 SDGs, Sustainable Development Goals, land on concrete reality through 8 programs, health being number 1, education and citizenship, empowerment, income, infrastructure, conservation, management and transparency, and R&D and innovation. So this is how we use the 17 SDGs and land participatory processes of identification of priorities locally. And our Force Health program deals with a number of challenges, including COVID. This is COVID testing. We invest a lot in training local experts, local community health agents, and we're able to organize a big alliance of 122 organizations around COVID in the Amazon. We mobilized about $8 million. We reached about 7,000 families through 7 work streams, from prevention to mental health, primary care in communities, treatment in hospitals, always in partnership with local administration and different institutions. Recently, just yesterday, I was in the middle of the forest in a place called Watumã, and we were able to make a breakthrough. And this stresses the point that I made in the beginning, the role of civil society organizations. This is local administration providing vaccines, which is their obligation, but they wouldn't have got there if it was not for civil or society organizations such as ours. And we're able to advocate a single vaccination effort rather than per age classes. And this is a small change, but made a huge impact in practice. So these are very fresh images from yesterday. And just to finish and illustrate this holistic approach, this is one of our small universities. We have 9 of those in the middle of the forest, and that's where we lend those work streams that comprise our holistic approach, including drinking water and so on. And with this, we're able to reduce deforestation in the areas where we work, which is about a couple of times the size of Wales, and we increased also income. So it's really trying to link all those agendas: conservation, reduction of deforestation, increasing income, and providing all sorts of issues that are the priorities of those communities identified through participatory processes of design and implementation. Thank you.
Wow, thank you very much. We have experience here, not only from academia, but also from practical experience. So indeed, we are making good our threats to tackle the topic titled From Theory to Practice. And we can see for ourselves what our panelists are already saying and what they have done. And now we know we're in good hands. We have always known that, but now we are convinced. We have had very powerful interventions from Vik, who is also a practicing doctor. Planetary health is not complete without the doctors. It's also not complete without the politicians. Ms. Davison, there you are. And it's also not complete without the engineers and the people who build and the people who make practical what we learned and what we are still learning every day. Thank you very much, panelists. I want to go on and direct a question to Ms. Davison. I would like to know from you, based on your experience as a politician, as a policymaker, and all those many things you've done, including writing about the planet as a patient, how do we change this frame of debate that we have been having? How do we have a better debate that is geared towards achieving planetary health on a bigger scale than what we have already. If you can also tell us about how we can do things differently and how law can help us do that.
Yeah, I mean, I think one of the real advantages of having a law is obviously policy lasts as long as people are elected. Or sometimes it doesn't even last that long, but generally, you know, if a party or a person comes into government on the back of a set of policies, then they last for that period of time. And if somebody else is elected, they come in with different policies. And the advantage of having a law is that law will still be in place when there is an election. And in almost all electoral systems, the current government would have to get rid of the law if they were going to change that. And it's much harder, I think, that if you've made a law supported by many of the parties in Wales to support not just young people alive today, but future generations as yet unborn, it's not going to be easy for an incoming government to say, actually, we don't believe that's a good thing. So I think the real difficulty in Wales was getting people to pass that in the first place. And effectively, it took from 2011, when I first proposed it, until 2016 for the law to actually be created. So it wasn't a slow journey. And I think that's why I actually put my book in the chat, or my website for as well, which has lots of resources linked to the journey, because you have to have a journey whereby some things will be really, really difficult. And often it's only when a wider group of people foresee that the way of tackling that difficulty is to have a law, that is what was successful in taking it forward. And the big difficulty that people identified in Wales was that without a law, nobody knew quite what to do. They all understood the principle of what to do, but you know, but Vik and Virgilio are real activists. They're just getting out there and doing it. And so the activists will get out and do it, but other people need leadership to get out and do it. And therefore, if the leadership becomes clearer and people understand what the law is trying to achieve, it then becomes easier to act upon it. So I think that's a really important point. And if I just pick up the question that I was asked about, will governments cause the problems too? And I think that is part of the reason that Wales wanted to pass a law, was so that it wasn't the kind of government that caused problems. And I think that therefore it's a bit like saying that we may acknowledge that actually, you know, Wales, the government in Wales, just like other governments, will have caused problems because it will have taken unsustainable decisions, often in the interests of what it thought were good economic outcomes. And normally in politics, economy trumps ecology. But in fact, we have to turn this round, and we have to ensure that people understand that ecology and economy come from the same Greek root. Eco, or oikos, is our planet home. And ecology is the knowledge of the planet home, and economy is the management of the planet home. And we need to know about it before we decide how to manage it. And we've currently got that the wrong way round.
Thank you very much. Yes, experience is a good thing. Now you're breaking it down for us. It's clearer, and we know we need what we need to do. We know we need good leadership, committed leadership, and leadership that is sensitive to the needs of the planetary health. Thank you very much. I want to go back to you, Mr. Viana, and pose this question to you because of how important it is. And I think it is linked to everything we do, because Jen has even addressed it by mentioning in passing that we can't know what we need unless we have leadership and unless we understand. So, Mr. Viana, tell us, how do we communicate these planetary health matters? How do we tell people, and how do we reach them? How do we do this? Assuming that from the academic point of view, from the political leadership point of view, everyone is doing their own thing. What do we need to do to communicate?
Well, I think what we need to communicate, I think there are two things. One is to the population in general, and so that people realize that protecting nature is good for them as individuals, not because of an endangered species or because of the planet as a remote idea, but something that comes close to your family. And to illustrate this, I think one issue is air pollution, which is one of the most severe health issues globally. And people in the Amazon suffer from air pollution coming from forest fires. So our strategy is to communicate that deforestation and forest fires are bad for your health and for your children and for your grandmother and so on and so forth. So that makes an environmental agenda closer to one's personal life. So that's one communication strategy that we have been pursuing. And this actually is one of the biggest challenges. There was a question about this in the chat. What are the biggest challenges? One of the biggest challenges is the narrative. Today, because of the narrative of the current government of Brazil, and it's important to remember that Brazil has three different layers of government. We have the federal level, the state and municipal levels. But at the federal level, the narrative is that deforestation is a part of development and it's relatively a good thing. That's a narrative. And we have to counteract and making the point that deforestation is not in the national interest of Brazil, but rather in the interests of a very few set of people that are having economic gains from illegal logging, illegal gold mining, and grabbing public lands. And the best way, in my view, is to link that with air pollution and health. The other narrative is to convince policymakers. And I was in government, as I mentioned, for 5 years. And I learned the mindset of politicians. And if we put aside corruption, which is a big issue, very important issue in developing countries, most politicians have their mindset geared towards votes. So we have to say that protecting the forest will eventually bring you, mayor, you, governor, you, whatever, more votes, because a standing forest is worth more than a logged forest. And that has to be said in very concrete terms, in terms of jobs, because jobs, Jane will certainly agree with me, that's one of the biggest things in politicians' agendas, which is job creation. So I say, let's create more jobs with a standing forest than by cutting the forest and having cattle. Cattle has very few jobs. So it's much better to have a forest with many products in terms of job creation. So these are the two communication issues that come to my mind to respond to your question, Cecilia.
Thank you very much. Very practical for us. Quite at home with the suggestions you have made. The strategies seem to work from what I can tell from the work you demonstrated today. So now I want to jump quickly to you, Mr. Mohan, and I want to request you to tell us what are the steps we need to take in developing programs that address planetary health challenges? It's a big question. They're weighty, all of them, but please, the floor is yours.
Thank you very much. I just want to say firstly that I'm really enjoying the contributions of my colleagues on the panel. I'm just really enjoying learning from your wisdom. So thank you both. In response to the question, and again, I'm really going to be reiterating almost the same things we've already said. I think it starts with being honest about the problem you're trying to solve. You know, let's remove our own blinkers. Let's remove our own sense of our own capabilities and areas of expertise. Let's start with an honesty about the problem. Okay, let's be honest about the problem we're trying to solve. And when you're truly honest about the nature of the problem, it will almost always come to light that actually the solution is not a single sector one. The solution is not a simple linear single sector one. And regardless of what your expertise is in an organization, and I'm implementing an organization where I represent one, it will almost certainly, you know, require you to collaborate, as Jane has beautifully elaborated upon. So it's going to require you to build partnerships with organizations, with partners who have complementary expertise, in my view and in our experience. So the next step then becomes, how can you create a collaboration and an alliance with organizations who share the same planetary vision, who can align behind the same goal, who ideally share a set of values that will dictate the ways of working, a set of values that ideally values the contribution and complementarity of each other as partners. So I think we need to be honest about the problem we're trying to solve. We need to seek out the strengths and capabilities and talents of organizations, partners that will complement ours. We must unite behind a shared vision, agree a common goal, and unite using a shared set of values that values that complementarity. And then it comes down to securing the support, initially the financial support to make it happen. And so much financial support for the work that I do and my organization partners is single sector. So how do we break those financial silos to secure funding to think in a holistic way? So that becomes a big challenge, securing the funding to enable us to work in a collaborative, multi-sector way to work towards a complex goal. Then how do we measure progress? How do we define success around that goal? And again, that's likely not to be a single sector linear definition of success. And how do we think holistically about defining and measuring progress towards success? And so that invites us to think much more courageously about evaluation. How do we evaluate the work that we do, this multi-sector, complex, often messy work? How do we evaluate that in a way that really captures the richness and complexity of the work that we're doing and the impact that we're having? That helps us to understand the added value, the non-linear interactions that are created when we work in this multi-sector way. So we've got to find partners that will help us to work towards a shared vision, unite using a shared set of values, work out how we're going to resource it, how we're going to work together, and then work out how we're going to demonstrate that we've achieved that goal. I mean, again, I could talk for days, and I know my colleagues on the panel could do the same, but that's it in a nutshell. Happy to talk more if it would be helpful.
Certainly, I'm sure we can set up bilaterals after this. Thank you very much. And also, thank you for highlighting the need for support. Oftentimes we speak about what we can do and what we do within our different circles, but finance is an issue that actually needs to be discussed. And that support could also be technical. Again, finances would come also in handy, among other things that you can achieve. Thank you very much. I now turn back to you, Ms. Davison. We would like you to tell us in brief, what is it that we can do? How then do we achieve these things that we are talking about? What do you need to make this happen? Briefly, because I can see we are at 6 6 o'clock from Kenya's side, and we have very little time for Q&A. Kindly, short and crisp. The floor is yours.
Can I really pick up a point, Virgilio, when he was talking about how the issues around communication. And I absolutely agree that this issue around the narrative and communication is absolutely key. Now, at the end of World War II in the UK, the incoming government did a huge amount of work on making sure that people had a new education system, a new health system. My father actually started work as a doctor on the first day of the NHS in the UK, that they had clean water, that there was a big house building program. And if we think about Maslow's hierarchy of need, you know, all those things that humans need to survive, clean air, water, shelter, food. The government at the time had ministries that did all of that. Now, I don't know about other countries in the world, but in the UK, all those things have become less important. And people have had to fight to get them back onto the agenda. And last year was the first time, and it was through a civil case, that somebody managed to demonstrate that a child had died because of air pollution on a road in London. And so I just think that those are the fundamental things every government needs to do for its people. They need to provide the means by which humans survive. So it is clean air, it's clean water, it's shelter, it's food. And if you don't do that, the government is failing its people. And what we now know in the context of climate change is that actually we have to change our behaviour hugely in terms of doing that. So I think that that is the framing in which we were able to pass legislation in Wales, and in Britain there's an added framing because we've had Brexit, our break from the European Union. And although it's not, I didn't support that in any way, what it is meaning is that Britain is having to redefine where it's going to get its food from, which means there is an opportunity for a debate. And I'm always somebody who treats barriers as opportunities for reframing the question. And I think the critical thing is that we focus on clean air, clean water, food and shelter, and saving our planet, because by doing that, the planetary health issue is critical to the human health issue. There is no separation.
Thank you very much. A very good point there. To get planetary health, there are things we need to do. And yeah, we just have to do it all, and we have to use the holistic approach again. We have had this from colleagues before. I want to pass this question again to all the panelists. It should be our last question, and it requires you to tell us, how do you get across this political party support that we need in order to get there, because they are the ones who ultimately make the decisions, lobby, etc. We will start with you, Mr. Viana. How do we?
Let me share from a very fresh experience, which was yesterday. Yesterday, I was in the middle of the forest with two mayors and one state secretary and two representatives of other secretaries at the state level. And how were we able to mobilize the interests of those politicians and policymakers? I think is by making the role of, or playing the role of facilitators. In general, governments are not very creative. And in general, governments don't like to take risks and innovate. So they tend to do sort of the same thing because it's low risk. And then they end up doing things which are not necessarily the most beneficial to people. So I think that's where civil society organizations play a very important role in bridging this gap, because we can afford taking risks, we are more creative, and by providing that leadership, we can engage these politicians and policymakers at different levels. So that's how we operate. Since this panel is very much focused on practical issues, and the example I gave is a very practical one, how to mobilize resources to bring vaccines to isolated communities in the middle of the forest. The vaccines were there, the health agents were there, but there was a missing link, which was a suggestion to change the policies so that we would have 100% vaccination rather than vaccination divided by age class, because of a very obvious issue. Remote communities doesn't make sense to go several times. It's much more efficient in economic terms and in terms of health impact as well, to do a single vaccination. And I think this case, very practical one, illustrates the role of partnerships, and also, which is a word that all my colleagues have also stressed in this panel, and also the role of having a holistic approach. Because by engaging these actors, and here again, the experience of yesterday, which is very fresh in my memory, we took advantage of our mission in the middle of the forest to also work on education, because we have a big challenge in avoiding the erosion of brains, the brain drain of youth that migrate to towns, which is a very important challenge. And we have a beautiful program on education for adolescents and young adults. And another agenda, which is on community-based tourism. This area in particular is one that has a huge potential for tourism. So in entrepreneurship for tourism. And by having a cross-cutting approach that deals with several agenda items, we also increase efficiency, because logistics is a key cost item in places like the Amazon. But it's not only the Amazon. If we think of the Congo Basin, it's also similar. If we think of other remote areas in Africa, is also similar. The same goes for Southeast Asia, and here I'm referring more to tropical forest regions. So having this a holistic approach reduces costs and increases efficiencies of programs that link not only governments, but also civil society and academia and business, increasingly so. We have the interests of business in engaging with this agenda. And I think this is my last intervention. Thank you once again for a very wonderful panel.
And it's a powerful intervention. Thank you very much. Holistic approach, and the example the comparison with Congo tells us that we are in different locations, but our environment is the same. Thank you very much. Mr. Mohan.
Yes, thank you. So just to clarify, the question is how do we engage politicians and government on these issues? Is that right?
Yes, briefly. Thank you very much.
Sure. So the way that Blue Ventures has done that is by providing a solution. You know, we as Virgilio says, you know, we in civil society can take more risks, are willing to be innovative, are willing to try and fail, and so we're probably better able to develop solutions and test them and check that they work more quickly. So what we have done is develop solutions to some of the challenges that politicians and governments are trying to grapple with. You know, work really hard to make sure we have compelling evidence of the impact of those solutions, so that we have, you know, compelling reasons to support the scale up of those solutions, as well as people's stories, so winning hearts and minds, and not just empirical quantitative data on the impact of our work, but the change that people's lives have gone through as a result of this work. And then we don't tell the story as the organization. We support partners, we support communities to tell the story for themselves. This is how my life has changed as a result of this solution. So because it's not our lives that's being impacted most significantly by this. It's the lives of the communities that we serve. So we develop solutions, test them, prove impact, prove scalability, and then allow communities to tell their story. And where possible, we build networks from grassroots partners to build that coalition, to build a movement, and allow the network to tell the story rather than it being.
Thank you very much for recalling that communities are critical in planetary health. Indeed, they are. And my organization also works with communities, and we support them, and which also has trickle effect, as Mr. Viana had mentioned. The trickle down effect is realized. I want to request for your punchline. What is the message that we must take home today? 1 minute for each panelist, and we could then see if we can answer any question that has been left unanswered. We have very few minutes, we have 8 minutes. If we could just give us a punchline, the thing that we must take home today, and you can answer any of the questions that have been addressed to you, because you can see there are several. Kindly. We could begin with you, Jen Davison.
Thank you. I have a very simple message. I remember reading it. It's from John Rawls and his theory of justice. He's an American philosopher. And the phrase that I use all the time is, do unto future generations what you would have had past generations do unto you. And I just think that if we live with that as our motto, we will not go far wrong. Thank you.
I support that 100%. I take that to heart. Thank you very much. Mr. Viana, your punchline.
I think we have, thank you, Cecilia. I think we have an urgency because the planet is very ill, and in these great illnesses, as Pope Francis mentions, we have to keep hope, because we don't have room for optimism, but we should keep our hope alive and lively. So my suggestion is that we use this meeting to build new connections, new alliances. I see a lot of people with interesting approaches and ideas, and I'd like to invite you all to work together here in the Amazon as much as you can. I had a look at the Size of Whales website, which looks very interesting. So come over and let's see, and I'll be glad to interact with any of you. I'll put my contact details in the chat, and let's make it happen. I think we have too many problemologists in the world and too few solutionologists. So we need to mobilize solutionologists and mobilize that for action. Former President Lula used to say that those who have experienced hunger have urgency, that those that have not had hunger. So we have urgency to act. And I think this is my final point. Let's transform all this awareness, all this knowledge and interest and resources into concrete action that benefit people and the planet at the same time.
Thank you very much. I have learned new words today. Thank you very much. And I will be the first, among the first people to contact you for further discussions. Mr. Mohan, your punchline. What message for us?
Thank you. Well, I'm going to build on what's already been said. I think the scale of the the scale of the problem that we're facing, the urgency, requires us all to show incredible courage in a way we've never shown before, probably. And the message I have, the punchline for me is, get out of your silos. Please, please, please. We need to get out of our silos. We need to get out of our comfort zones, speak to people we don't normally speak to, form alliances, work out how we can work together, because the scale of the problem and the complexity of the problem requires us all to work together to that shared goal. No one person has got the answer. I would love to talk more. If anybody want to talk more, the questions I haven't been able to answer yet, please email me, Vik, V-I-K, at blueventures.org, or Vik Mohan1 on Twitter. Would love to hear from you.
Thank you very much. Mr. Vik Mohan, thank you for the parting shot as well. And we are going to wrap up this session today. Fellow colleagues and participants attending this meeting, we thank you very much. Unfortunately, we didn't have lots of time to answer all the questions, but I know the panelists have answered some of the questions as we went along because they could read them. If any of your questions have been left out, please feel free to contact them and follow up. And it's also good for networking. We appreciate all the participants and all the panelists. Thank you for such a great discussion. And we look forward to future actions and more, what do you call them? Solutionists. What did you call them, Mr. Viana? People who provide us with solutions. We need more of those solutions. Solutionologists, yes. And therefore, we today thank all the participants and all the panelists, and we thank the Planetary Health team for putting this together. We would also recommend that you go look up the work that has been done by the panelists in their separate activities, the written material about the patient who is planet Earth, and about the law, and about Blue Ventures and what they are doing, and inspiring works also from across the globe, from Brazil, from Mr. Viana. Unless if I have forgotten to thank anybody, I wish to let colleagues and fellow participants to attend to the other meetings that they have. We have 2 minutes before we close. If there's anyone else who wants to say hello to us, you have 1 minute. Thank you very much.
Thank you so much.
Yes.
Yeah, thank you so much for you and for the 3 panelists. It's a wonderful panel. I would just like to remember our attendees that in 10 minutes we'll have a very interesting interview on leadership and planetary health lens in governance and policy. So don't miss that. Thank you.
Thank you very much. And we will join you in that meeting, myself included. Friends and colleagues, thank you very much. Have a lovely evening from Kenya. And good morning for those who is still shining.